and hopefully.
All right. Good morning, everybody. Today is Thursday, October 28th. The time is 9:02 a.m. and I would like to call to order this meeting of the Alameda County Lead Poisoning Prevention Program Joint Powers Authority. And before I do the announcement of how this meeting will be conducted, if you would please take the roll.
Director Hardy. Hardy absent. Director Gallo.
Present.
Gallo present. Director Vela. Vela absent. Director Winra.
Present.
Winra present. Director Bouders.
Here.
Bouders present. Mr. Chair, you have a quorum.
Thank you, Ladise. And so as we begin this meeting, I would just like to, for the record, state that in response to the COVID-19 pandemic and pursuant to Government Code Section 54953, which was amended with Assembly Bill 361, the Alameda County Lead Poisoning Prevention Program Joint Powers Authority meeting for the Board of Directors is being held via teleconference. Members of the public can also attend this meeting in person at the Alameda County Healthy Homes Department at 2000 Embarcadero Street, Suite 300 in Oakland. Members are encouraged to watch this meeting using the link provided for on the agenda posted on our website or by dialing in using their phone to the phone number and passcode provided on the website. If you are attending that meeting via teleconference, you can provide us written comment for any agenda item or for items not on our agenda by raising your hand during the public comment portion of this meeting or by emailing Ladise de la Fuente at the email address provided in our agenda packet. Please include your name and identify the agenda item you're wishing to address us on. And if a comment falls under that item or general public comment, I will call on you at that time. And if you require an accommodation to attend this meeting, please contact our offices so we may assist you. Okay, with that, I will move to agenda item number 2, which is public comment for items not on this agenda. There's no hands raised right now in the public. And as a reminder, if you're joining us by telephone as a member of the public, you may press *9 and I can see your hand at that time. Ladise, did you receive any comment cards for general public comment or any items on the agenda today?
No public comment.
Okay, so there are no comment cards, and if that changes, Ladise will let me know. So that will move to item 3, resolution for AB 361, the open meetings, state and local agencies. As I mentioned, the governor's executive order expired on September 30th, and in order for this this agency to continue operating via teleconference, we have to make a finding every 30 days for the following 30 days that we believe that there are factors that exist that necessitate for the safety of the health and of the public's health, that we continue to conduct these meetings via teleconference and comply with all the rules that were previously in place in doing so. There is in today's packet a draft resolution for the chair to sign that would comply with this item. And Director Brooks, do you have any additional staff comments about this or how this would be implemented for the benefit of our other directors?
One of the things that we have observed since we began doing these virtual meetings is that we are experiencing much better attendance, participation in the process, because people are able to remotely access the meetings. The meetings are being recorded now. And so we do get hits on our website. In fact, the last meeting had over a dozen hits on the YouTube channel, in fact, because we are able to record these meetings doing it virtually. I'm not sure that if we go back to attending in person, if we will have that capability, and therefore we may lose some of the participation that we're now getting from the public.
Okay, thank you. Are there any public comments on this item?
No public comment.
Thank you. Seeing none. Discussion. Any members wish to discuss this item? I have a couple of comments, but I want to give others the chance first.
I'll make a motion to approve.
Okay.
Second.
Okay, there's a motion and a second. And I just want to clarify for the record that this law that authorizes this does have a sunset date in it. And it does have a couple challenges because it requires us to make findings every 30 days. And we don't always have meetings every 30 days. There's that problem has come up at our city already and at the Transportation Commission. So I just want to flag when we take August off, for example, we're going to actually have to have a special meeting just to do this in order to have the ability to continue doing it in September, for example, if that's what we wish to do. And the other thing I would note is that we need to just be mindful that the resolution requires that the reason we're doing this isn't public convenience. Unfortunately, I wish that was the reason that they allowed us to do it, because there are a lot of benefits to having this remote access. We have to find that that there's a health emergency which necessitates the remote access. And so the resolution does say that, and there's a motion and a second on that resolution. So that would be the findings today, but I just want to clarify that for our record, that would be what the directors are voting on. Director Wengraf.
Yeah, is there any way that this item can be considered like a consent item so that we don't have to take it up at every meeting?
Once we have adopted it, the next item I was going to do is ask folks if we could just have a consent agenda for minutes and this going forward, since this will be a standing item most likely. And then we could simply take a motion on a consent calendar if that's of interest to folks.
Great, thank you.
Okay, so are there any other comments on this item? Okay, seeing none, there's a motion by Director Gaio and a second by Director Wengraf to approve the resolution. Please call the roll.
Director Gaio,
Aye.
Gaio, aye. Director Vella, Vella absent. Director Wengraf,
Yes,
Wengraf, aye. Director Bouters,
Aye.
Bouters, aye. Director Hardy, Director Hardy absent.
Okay, the motion passes and the resolution is approved, and the agency will have authority for, I believe, the next 30 days now, which gets us to our November meeting. And then we will get to our December meeting, and then we will have to figure out a solution because we will have a longer gap between December and January than 30 days. So this is a fix that the legislature and the governor is an oversight. There's a lot of issues with the dates. It should be 60 days, or next regular meeting should be the standard. So hopefully the legislature will fix that early in the coming year. We will not have to call special meetings just to do this issue. But now, is there consensus from my colleagues that they would like me to work with staff to have a consent calendar now in the agenda? Because previously it was just minutes and we didn't really need to call it consent, but I'm happy to have this as a standing consent item if folks would like to do that. Director Wengraf gives me a thumbs up. Director Guy, you're fine with that as well?
Yes, I'm fine with it. Thank you.
Okay, so staff, the direction will be that I will email you, Ladise. We're going to have a consent calendar item after roll call and public comment. It will say consent calendar, and we will be moving the minutes and this item as regular items there, so we can just approve all of those items with one motion going forward. Okay.
Okay.
All right. So thank you for that. That concludes. Is there any questions from staff?
No,
No. Okay. That moves us to agenda item number 4, which is the meeting minutes for September 8th, 2021. Are there any comments, corrections, or questions about the minutes? Is there any public comment on the minutes?
No public comment.
Okay. Is there anybody who would like to make a motion on the minutes?
I move approval.
Second.
Okay, there's a motion by Director Wengraf and a second by Director Gaio to approve the September meeting's minutes. Please call the roll.
Director Gaio,
Aye.
Gaio, aye. Director Vella, Vella absent. Director Wengraf,
Yes,
Wengraf, aye. Director Bouters,
Aye.
Bouters, aye. Director Hardy, Hardy absent.
Okay, the minutes are approved. Thank you. We'll move now to agenda item 5, which is the director's report. Director Brooks.
oh, thank you. Ladise, can I share my screen now and bring up the PowerPoint?
Sure, I'll stop sharing.
Okay, dokie. Let me see here. Share screen. Share. And can everyone see that?
mhm.
Yes.
Okay, great. Again, we're off to a much better start than last month. All the technology is working here. The director's report. Let me see if I can then get the pages to work for me. Okay, so first off, we want to welcome back Director Bouters.
You're hilarious.
Yeah, I mean, honestly, the staff and I think some of the directors themselves were a bit worried about you. And so we did kind of track you on your journey there on Twitter, and also using the GPS device that you had. And we're glad that you made it back. and we're looking forward. A lot of staff say they really would like to hear from you some stories and see some pictures. So maybe at the annual holiday gathering,
Sure.
you might be able to do that for us, but we just wanted to say welcome.
Well, thank you. I will save the stories. I 18 days hiking in the wilderness alone. I saw a lot of wildlife. I had a lot of fun. It was quiet and the air was the air monitors was zero. There was no pollution anywhere near me and it was fantastic. And I came back very zen and I have maintained that for a month now. So I'm in a great place of mental health and state of being. And I lost 20 pounds
Oh, my
on my
God.
hike. Yeah, I lost 20 pounds, do about 20 miles a day with a pack and go up and down. And that happens too. So I look like my college age self again, which is fantastic. Don't know how long I'll get to keep that, but we'll share a couple of fun stories and tidbits when I get to the annual holiday party and maybe a couple pictures too.
Okay, great. The next thing we wanted to share with everyone is happy National Lead Poisoning Prevention Week. This is National Lead Poisoning Prevention Week. And so as a result, there are lots of different things going on here within the department as far as marketing Lead Poisoning Prevention Week, making people aware of the dangers of lead poisoning and lead poisoning prevention strategies, doing a lot of stuff on social media, radio, other platforms, also a lot of virtual webinars and seminars. In fact, I'm supposed to be speaking on a panel later today, a national panel. The Center for Disease Control just did a 30th anniversary webinar that I was able to attend yesterday, not as a speaker, but as an attendee, and got to hear some wonderful stories from people about the advances that are being made by child lead poisoning prevention programs all across the nation over the last 30 years. The Board of Supervisors is actually reading a proclamation. It was scheduled for this past Tuesday, but they got kind of hung up in those discussions about the Oakland Athletics Stadium, and those discussions went on until about 9 o'clock or something Tuesday night. And I had to leave before they could read the proclamation, but they agreed to carry it over to next week. So we will have that proclamation to share in the future. And future meetings will share all the different things that we did for Lead Poisoning Prevention Week. The education engagement team has done a remarkable job of using this as an opportunity to make people aware of the dangers of child lead poisoning. I want you to also know that several months ago, we had reported to you about the congressional report on toxic metals in baby food. There was a new report came out from the U.S. House of Representatives last month, in which they again kind of admonished the Food and Drug Administration for allowing the baby food companies to basically police themselves. As a result of that, you'll see in the lower right-hand corner, the Food and Drug Administration is now coming out with a new approach to how they're going to police the baby food companies. And we will keep you aware of that, how well it's going. I know that the JPA wrote a letter of support to the signed on to the Environmental Defense Fund's petition to have more regulations done to bring down the levels of toxic metals in baby food. And you may end up wanting to follow up with additional letters depending upon what happens next. Rochester, New York, which is considered pretty much the gold standard for child lead poisoning prevention in terms of all the strategies that they've implemented, just came out with a new report basically celebrating their nearly 30 years of involvement in child lead poisoning prevention. And they listed in their report a lot of do's and don'ts. And in fact, one of their biggest don'ts that we shared with the City of Oakland lead paint settlement negotiations team in light of their new race and equity impact assessment report, where they've come up with some recommendations for how they want to approach lead poisoning prevention in Oakland. And one of the things that they are considering is trying to completely remove lead-based paint from properties, or at least a select number of properties. And that is something that would be the ideal situation. But places like Rochester, in their report, they talk about how they considered that when they first began their lead poisoning prevention initiative. and concluded that it was going to be way too expensive to do that. We've also played around with numbers in the past and have come to realize that it would just cost, in the billions to try to scrape all the lead paint off of every pre-1978 home and then repaint them. So what we are stuck with is what is called interim controls, which is, try to just address the portions of paint that are deteriorating, particularly friction surfaces like windows and doors. So we passed this report on to the City of Oakland's lead paint settlement negotiations team so that they might take a look at it and consider all of the do's and don'ts that Rochester has come up with in their report. The California Healthy Housing Coalition received the Bishop Ron Allen Award from the California Association of Code Enforcement Officers. And I bring this up because the Healthy Homes Department was one of the founding members of the California Healthy Housing Coalition. And we still sit on their steering committee. And I was actually asked by the Healthy Housing Coalition to accept the Bishop Ron Allen Award on their behalf, since of course I was there in Olympic Village at Tahoe for the annual code enforcement seminar. Bishop Ron Allen was the president of the Congress on Racial Equality. He has been a friend, a champion for many of the pieces of legislation that the California Healthy Housing Coalition and KCO have sponsored, everything from addressing substandard housing to helping code enforcement officers in regards to regulation of cannabis dispensaries, illegal massage parlors, and sex trafficking, you name it. He was pretty much, I consider him KCO's spiritual leader. He was working with me on some strategies for lead poisoning prevention legislation when he suddenly passed away. And KCO was just so struck by it that they decided that they should create this award so that for future seminars, they would hand it out to individuals or organizations that they felt that Bishop Ron Allen would be proud of. So we are the first to receive it, the California Healthy Housing Coalition. And as such, Bishop Allen's family traveled to Tahoe to be present for this first ever award. And so there were many tears and cheers at that event. Which came as a result of the lady here that I want to point to down in the bottom of the screen. Jamie Zeller was the one who suggested this. And she was just elected at the annual seminar to become the president. And you see on bended knee there, Johnny Tilfer, who was a past president of KCO, who was doing a presentation in front of 400 code enforcement officers there at Olympic Village, when suddenly he called Jamie up to the front of the ballroom and knelt down and proposed. And I had my phone camera ready and took a picture of it. So I guess you could say Jamie's first action as the new president of KCO was to answer his proposal. Her next action was to ask me to stay on the board of directors for KCO, because I had notified the Bay Area Code Enforcement Network that I was stepping down in order to do some mentoring for younger code enforcement officers. I really believe in KCO's plan for sustainability in terms of succession planning. And so I announced that I would not run for re-election and I would allow a younger person to take my place, which that did happen. But Jamie came to me and said, Larry, I need you on this board. Would you consider a special appointment? And so I guess you could say that Johnny proposed to Jamie and Jamie proposed to me, and we both said yes.
So remind me never to go to a KCO conference, because I have a phobia of proposals. I I would be terrified walking around that place. I had a marriage proposal once and I said no, I was so scared. So, okay, well, I'm glad that you got proposed to, and I want to thank you for prioritizing young people in leadership. I think that's fantastic. So glad to hear that they're keeping you in a special capacity. And it looks like you have some more to contribute. I see a man with a little yellow arrow, so can't wait to hear about Mr. Givens, it looks like.
Orlando Givens, City of Alameda, will be receiving a commendation from the County Board of Supervisors next week. Typically, the proclamation for Lead Poisoning Prevention Week that is read by the Board of Supervisors is followed by a proclamation declaring Code Enforcement Officer Appreciation Week, which is also in the month of October. A new tradition that started last year was to also include a commendation to a code enforcement officer within Alameda County for outstanding service. Orlando Givens is being recognized in part because of the work that he has done for what was the Alameda County Code Enforcement Network. He served as vice president for several years and has continued to be a member, has done lots of presentations in front of code enforcement officers like what you see here. This photo that I happened to take some years ago when he was talking, I guess will now kind of become a historic photo for code enforcement officers here in the Bay Area. You'll see to the left of him sitting down, looking very attentively, is Dean Baxter, code enforcement officer for the city of Dublin. He is one of the founding members of the Alameda County Code Enforcement Network. And over to the far right is Daryl Revere, code enforcement officer for the city of Livermore, who's also one of the originals with the Alameda County Code Enforcement Network, which under Orlando Givens and President Ed Labaya from Alameda County Code Enforcement, they have grown this organization to the point where a couple of months ago, the name was changed to the Bay Area Code Enforcement Network. Sadly, I have to point out in this picture, there's a lady right in the middle of the picture wearing a hat. That is Yvonne Grundy, code enforcement officer, state certified code enforcement officer, zoning investigator for the county of Alameda, who we sadly learned just this week that she suddenly passed away. So the Board of Supervisors next week is going to do their meeting in honor of her. And we're really devastated by that loss. And we really appreciate that the board is going to do that. If I were to do any type of meeting, I would also want to do it in memory of her, because she was one of those unsung heroes who did a lot of stuff behind the scenes that helped the Alameda County Code Enforcement Network grow into the Bay Area Code Enforcement Network. So we're all sending our condolences to her family, and KCO is going to do some type of special condolences for her family as well. 30 years of Healthy Homes Department. We've been talking a lot about our 30-year anniversary, and so we were going to do a special slide presentation anyway in honor of that, but we're going to do things a little bit different. So I want to kind of set the tone for the next set of slides, and I'll explain the situation. As you know, the City of Oakland did a race and equity impact assessment report related to their proposed distribution of lead paint settlement funds. A summary of that race and equity impact assessment report was presented to you on September 8th in a roughly hour-long slide presentation. And in fact, you requested a copy of that slide presentation, which we were able to obtain for you kind of inadvertently. We were able to receive it through one of the members of the Board of Supervisors, in fact, because we couldn't get it from the Oakland team. Others who heard about that presentation also requested it. And in fact, as I mentioned before, about a dozen people watched the recording of the JPA meeting on YouTube after receiving that slide presentation. And I'm not sure how many hits we got on our own website for that video, but we've been receiving comments and questions from those observers, and it includes some members of the press. And they're all requesting, those who haven't received the slide presentation yet are requesting that, plus they're requesting the race and equity impact assessment report itself, which has not been made public. Our negotiation team only recently received the yet to be published copy of the race and equity impact assessment, and were instructed that we were not to share it yet until it was finalized. But I will tell you that in reading that 77-page document, that some got the impression that it was not very flattering of the Healthy Homes Department, which I'd like to see it from a little bit different perspective, that we've been around for 30 years and yet have not eradicated lead poisoning. And thus it is quite understandable how someone on the outside looking in might get the impression that our department has not been as successful as one might expect. Thus, we've been advised to go on record in regards to our 30-year history of addressing child lead poisoning, not only for you, the JPA, although I know a lot of this is going to be preaching to the choir. You're pretty familiar with our work, but we're also required to go on record for the general public that may end up watching today's meeting or being part of today's meeting, in fact, and plus just for our own staff morale. I think that we have an obligation to present some of these slides covering our 30 years of work. So I would just ask that you be patient, and we're going to hand this over to Dale so he can go over those slides with you. Ladice, let's see here. Dale, I have control, so just tell me when you want me to move to each slide.
Okay. So I'd like to go back a little bit and talk about the history of lead poisoning and how it was viewed and seen. The initial blood lead levels that were causes for concern were when children were having seizures and dying, and everyone agreed that that was a problem. As they did more studies, the levels were lowered down to, that was up at the 60, 75 micrograms per deciliter. They were lowered to 40 micrograms per deciliter and then to 25. That was about when I started working on the issue. Then they were subsequently lowered to 10 micrograms per deciliter, which is a millionth of a gram per tenth of a liter, as a level of concern. And as had happened every time a level was set, scientists began studying the next levels down, and finally determined that there's no safe level of lead in the blood, and that any, on a population basis, any level of lead in the blood, some children will be harmed. So the CDC took a different approach and established a reference level wherein 97.5% of all children would be below that level, and that's currently set at 5. So through the 1970s, lead started to get onto people's radar screen. HUD took some first steps to address it in their programs, and it was added to the National Health and Nutrition Examination Survey in 1976. And eventually by 1995, it became the first non-infectious condition to be notifiable to the CDC at the national level. Before that, it was things like cholera, yellow fever, things like that, but blood lead was raised to that level. And so locally, statewide, it also was becoming an issue. And in 1987 study, the Kennedy Tract in Oakland was identified as one of the top 3 in the state for lead poisoning rates. And local community groups, especially People United for a Better Life in Oakland, began advocating for a county program to resolve the issue, and working with then the county supervisor at that time to put together a program. And in 1991, a program plan was developed to look at how the county might do this comprehensively. And that was followed soon after by the establishment of a lead abatement program, of which your board is the board of directors for the Joint Powers Authority for Alameda County and the 4 cities of Alameda, Berkeley, Emeryville, and Oakland. That was followed soon after by the federal 1992 Residential Lead-Based Paint Hazard Reduction Act, and that required federal agencies kind of across the board to take a serious and coordinated approach to what they did. That led to EPA establishing lead hazard standards and abatement certifications, which then came down to the state in the form of Title 17, HUD guidelines in terms of how to do it, and the HUD lead hazard control grants, which have been a major part of our funding for our activities. And then finally, the EPA's renovation, repair, and painting rule for general construction in residences that came out in 2010. So at the time, I just wanted to look back at the 1991 plan. It had envisioned 3 interdependent areas addressing children at risk and bringing them medical treatment, testing their homes, doing outreach about the dangers of lead, then high-risk homes to identify those and remove lead from the homes, which present the greatest dangers. At that time, the age of children that we were looking at was up to age 6. And then training workers and medical case managers. So we've done, we have a contract with the state of California for all of Alameda County except for Berkeley, which has its own public health department. We have, of course, the county service area for the 4 cities to educate property owners. And then we've had the HUD lead hazard control grants and other grants that we've been able to get. And so we've done provider and community outreach. I think awareness in the county is probably highest within the county service area because of our long time work there and the support of the board and others. And working in those 4 cities. We have a much stronger system in place for the children at the highest lead levels, including the HUD grants, education and training, as well as a good compliance system with cooperative compliance as a start, followed up by the district attorney or environmental health when we need it. But we have a triaged approach due to resources. The highest levels, we call a medical case level, get a public health nurse, case manager, and an environmental investigation. The next level down, we do a lead poisoning consultation, which had included a site visit pre-COVID, now being done by phone. And at the lowest levels down to 5, we're providing education and information to the families. So we have had 11 HUD lead hazard control grants. We've tested 3,300 homes, remediated 2,100 of them. That program provides a good resource for responding to lead poisoned children, to families who can't afford to fix up lead hazards, and also removes an excuse for rental owners where there's a lead poisoned kid in terms of why they can't address the lead hazards. Also has established a standard of practice and supported an infrastructure of consultants and contractors that do work for the private sector and other agencies. And we've had made good progress working with building departments and code enforcement to promote general compliance. In training, we've trained over 3,900 people in lead safety and healthy housing, and that includes contractors, renovators, property owners, property managers, as well as staff from agencies and community-based organizations. Lately, we've had a stronger focus on training code enforcement officers. And the bottom there talks about training the medical case managers in in-place management of contaminants. We have brought the public health nurses early on. We recognized for a comprehensive program, we needed to bring the public health nurses in office. So they work directly with our environmental and housing staff. But there's more that we could do on that general theme in terms of training outreach workers and home visitors. Larry, next slide. In terms of the scale of the problem, there's just over 400,000 pre-1978 housing units in Alameda County, 34% of which are in Oakland. Intact paint is not considered a hazard. So it's when the housing has deterioration, deteriorated lead-based paint, bare contaminated soil, lead dust, and during renovation. And then in terms of the bare contaminated soil, there's also neighborhood effects in terms of neighborhoods with lots of old housing where paint has been peeling for years and years, as well as industrial in sources and lead in gasoline. Next slide, Larry, please. So our main program areas are the Childhood Lead Poisoning Prevention Program under the state and the health officer. We have the county service area for property owner education services in Alameda, Berkeley, Emeryville, and Oakland. And then we have our housing repair programs, the lead hazard repair grants, and the minor home repair grant program, which we primarily use as CDBG funds. And then we have a training program. We are EPA accredited for the RRP training, and we do also provide healthy housing training. And so we have in one department, the public health nurses, housing folks, environmental outreach, and training. Next slide. We do a wide variety of education and engagement. We recognize the need to do more, and we're hoping that settlement funds will allow us to really reach out and reach the whole county and make people see that this is has to be a concern for everybody. We've recently, as we've been reporting back to you, the board doing more with our social and traditional media to get the word out, and we want to continue that and do more. There's approximately 240 EBL children per year that receive those tiered services that we talk about. We also do general parent outreach and education and education support for medical providers so that they understand what the concerns are when they have questions about their patients. County service area, we do the property owner education services and property owner training, and then the healthy homes repair programs, the lead hazard control grants, minor home repair, and we've also gotten healthy housing grants. Currently, one of our main training efforts has been with the Cypress Mandela Training Center. They have a construction training program that works with large contractors and PG&E, and we've been assisting them by providing the one-day RRP training, which for most of them has been leading to their certification as certified renovators. And then in terms of compliance, we respond to people's calls and concerns about unsafe renovation and work with local code enforcement and building departments in order to see if we can get those lead hazards addressed. We're also working on a program to assess independent living homes for a variety of healthy homes issues. This slide was prepared for our negotiations with Oakland, but it's representative of the types of partnerships and relationships we have in the CSA and countywide. Other examples would be making presentations to Berkeley Property Owners Association. We have good relationships with Berkeley Public Health and the building departments. The Emeryville Building Department has been a really good partner. Presentations outreach to Annie Yates Elementary. We've done presentations at the Alameda Housing Authority for their Section 8 property owners and work with their housing rehabilitation programs. We do outreach and medical provider education at Alameda Hospital, and we've worked with the Alameda Point Collaborative in the past. Countywide, we work with childcare associations like Four Seasons Bananas, Alameda County's Safe Kids program, the Women, Infants, and Children, and Head Start programs. Schools. I think your board directed us to do outreach countywide to schools in terms of the lead safety at home issue, and then educating healthcare providers. Next slide. Okay, so where have we been? So we've seen an increase in service needs. I mean, one of these has been the recognition that there is no safe level of lead in children's blood. And the revenue hasn't kept up with inflation. The state contract, we've gotten some increases, but there's still this issue of harm at lower levels and expanded caseload. County service area and fee has been unchanged, and lead hazard control funding has been largely flat in terms of the dollars per grant, which reduces the number of housing units we can do and the resources for the training and outreach associated with that. Next slide. So that's led to, children at the lower levels who are at risk of harm, or if their blood level is increasing, we want to do more to outreach to those folks and keep kids' blood levels from increasing and get them down as quickly as we can. We've had to reduce our lead safety training programs, reduce outreach. We have less, we can do fewer units in our lead hazard repair grants, and we've had to cut back on other services that we used to offer. We're looking at, restarting those. We have the CSA lead safe paint kit, and we're looking at the HEPA vacuum lending program to restart that. And we have brought in a outreach coordinator who's been working on our website and social media. So, we're working on these issues, but we hope that this additional settlement funding can really make a difference for us in terms of bringing back and expanding and enhancing the services that we provide. And that is, so we want to train more contractors and maintenance workers. Lead safety needs to be part of all property maintenance activities. Folks have limited resources, owner occupants, even many rental property owners are struggling. The one gap that we see is with the lead consultants. There's not enough demand for them to maintain this as a service. We want to have more testing available in our community at a reasonable rate. And we still think that there's much to do to support code enforcement programs in their lead safety, to incorporate lead safety into the work that they do. And that's the end of my section. So Larry, back to you.
Okay, thank you, Dale. That concludes the director's report. If there's no questions, I can go into the lead settlement negotiations.
Let's take a pause and just see before we have an agenda item here. First, is there public comment that was received on this item, or any members of the public raising their hands? I see none.
No.
Okay. Is there any questions about this section of the report to Larry from anyone on the board? Director Wengraf?
Yeah, I'm curious to know, as we see old housing stock renovated and new housing stock being constructed, are we seeing a trend down in lead poisoning?
We've seen a downward trend in child lead poisoning rates over the past few decades, in fact, but it wasn't associated as much with replacement housing as it was with the efforts being made to do outreach and education to the community, making them aware of lead hazards and how to address them. The HUD lead hazard control grants that Dale has administered over many, many years, I believe has also played a role in seeing that downward trend. And I think also probably, like I learned yesterday from the CDC webinar, is just in terms of their learning curve with regards to lead poisoning, because in the early years, they thought that a child could have a blood lead level of, say, 50 micrograms per deciliter and it not do them any harm. And over the years, they've become aware of the harm that it is doing, and they've been reducing the threshold, what they call the action levels, over the last several years, to where now they say 5 micrograms per deciliter in a blood lead test is an actionable level, and they're even saying that there really is no safe level.
Right.
And so with that learning curve, there's been an increase in terms of efforts and strategies, things like proactive rental inspection programs and other proactive measures being taken in order to result in that downward trend that you're seeing with regards to.
If you compare Alameda County rates to those rates in other counties, how does Alameda County compare?
We are in pretty bad shape, actually. Our child lead poisoning rate is still higher than Flint, Michigan, which was 5. 5%, and we're in many of our zip codes. In fact, in Oakland in particular, Director Gaio's district, Fruitvale zip code is considered ground zero with the highest child lead poisoning rate anywhere in the city, which is above 7%.
Okay, so nationally, and in terms of comparable counties in the state, where Alameda County is higher.
Pardon me again?
So in terms of relative to other counties in the state, Alameda County is higher in terms of its.
In terms of
poisoning.
child lead poisoning rates, there are other counties with similar high rates. That was part of what sparked the action against the paint companies 20 years ago to sue them for having sold lead-based paint for decades after they knew the harm that it was doing.
Okay, thank you. Thank you.
Okay, thank you, Director Gaio.
Yeah, yes, can you make these slides available to us?
Yes,
There.
sir. Certainly will, Director Gaio. In fact, many of the slides in Dale's presentation in one form or another were presented to the Oakland's lead paint settlement negotiations team, because when we first started meeting in the summer of 2020, the members of the team said that they weren't really aware of our department, our program services. They pretty much admitted that they didn't know a lot about child lead poisoning, period. So we spent several weeks presenting slides to them, what we call lead poisoning prevention 101 classes, which we do in the community a lot. And we also presented them with a number of slide presentations describing the services and experiences that we've had over the last 30 years, because we were basically trying to make an early case for why City of Oakland should want to partner with us in the use of the lead paint settlement dollars, which they have come to agree that to some level, at least, we should be partnering.
Well, if I can at least, if you can send them to me, I'd like to sit down with you, because sometimes the information does not get from one place to another. And certainly know the problem, know the issue, and to be able to hear from you today that that in the Fruitvale area, we still have one of the highest problems that we had from the beginning that generated this discussion or this action to move forward. So I'd like to, if you can send those to me, please, and then I would have a better sense from you, where are we with our negotiations? Just to be clear with that we're on the same page, and then down the line, I would like to have you and your staff be able to present to the full city council in terms of the work that you're doing, need to do, and also the needs for additional support to get to the problem. But anyway, send me the slides and I'll check back with you, and you can go over them with me, then we'll move forward with it. All right.
Okay.
Thank you. Thank you.
Okay. Are there any other final comments or questions for this part of the director's report? Okay, seeing none, we will close the director's report and we will move to item 6, which is the lead settlement negotiations.
And I'll start off by saying, Director Gaio, we will be happy to send you copies of these slides as well that I'm going to be presenting, providing an update and in part a response to the slide presentation that you saw on September 8th that was presented by the Oakland lead paint settlement negotiations team. But for the general public who might end up watching a recording of this, just as background, as I mentioned before, over 20 years ago, 10 jurisdictions got together and they filed lawsuits against the paint companies for selling lead-based paint long after they knew the harm that it was presenting. And this was a very long, drawn-out fight. Things got very ugly. It went through many appellate courts and even to the Supreme Court, where It was not heard by the Supreme Court and then came back down through the California courts. During the 20-year battle, there were lots of depositions that the Healthy Homes Department staff had to do. There were lots of records, thousands of pages of records that the paint companies demanded that they receive as part of this long drawn out fight. In the courtroom, there were lots of discussions and evidence presented like what you see here in terms of statements that were made by people in the paint industry that clearly were racist. Basically, the argument of the jurisdictions was that systematic racism was playing a role in the problem. And this was part of the reason why the paint companies needed to be held responsible. The original judgment in 2014 was $1 billion to those jurisdictions, but through all of the appellate court action, that amount was reduced down to a little more than 300 million. So Alameda County and the city of Oakland were both jurisdictions involved in the lawsuit. Originally, the judge had ruled $100 million to be awarded. We ended up with an out-of-court settlement of $24 million, which, as I always say, it's a symbolic victory, not really a solution to the problem. The problem will take billions of dollars. I know Dale did an analysis once where he concluded that just to do what we talked about earlier, interim controls on all pre-1950 housing in the county would cost over $500 million, if that gives you an idea of how big this problem is. And when you're talking interim controls, you're of course talking about something that has to be done every several years as the paint on older houses deteriorate. So it was this symbolic victory that has spurred other states to try to sue the paint companies that we are now negotiating with the city of Oakland. Other jurisdictions involved in this settlement were counties, and therefore they're able to go forward and spend their money as they so decide. But because Oakland was involved in the settlement, the judgment included a requirement that we get together and reach an agreement. So as I mentioned earlier, the Oakland team did present to you a summary of their race and equity impact assessment report, and we actually have an unpublished copy of that report. As I said before, they shared it with us recently. We can't release it. And though, as I also indicated, it's somewhat critical of the Healthy Homes Department's efforts of the last 30 years, this presentation is really not intended to debate the Oakland proposal. In fact, we have an MOU that has been drafted by our county counsel's office, and it is being looked at by the city attorney's office. And we hope that this MOU that actually is a counter proposal to what you heard on September 8th will be accepted so that we can move forward with child-led poisoning prevention. The Oakland negotiations team currently has the city manager's office represented on it, the building and planning department, the housing and community development department director is new. We just met her a few weeks ago. The race and equity director came on late after we had went through our lead poisoning prevention 101 meetings. And the city attorney's office, unfortunately, the attorneys that were actually involved in the litigation over the last 20 years are not there. The deputy city attorney that had been with us these last 2 years of the negotiations is now on maternity leave, and her supervisor has now joined their team as of 3 weeks ago. So we're playing a little bit of catch up. The Alameda County negotiations team is, of course, made up of Healthy Home staff and county council staff. And for the last 2 years, we've had perfect attendance at our meetings, although there is a meeting tentatively scheduled today that I may have to miss out on because of the Lead Poisoning Prevention Week, the national panel that I'm supposed to be a part of. But these slides are simply to kind of provide you with some background so that you understand the counter proposal. Again, just for the public's understanding, the original lead settlement by the courts came out in 2019. And we began having our meetings back in 2020. In the early parts of the meetings, we laid out the groundwork for why we felt that we should take responsibility for the use of those funds. The city of Oakland countered with their race and equity ordinance that they were required to do a race and equity study first before they could respond to our proposal, which was originally 42% to Oakland. They then asked us to provide them with a number of data sets, including information on child lead poisoning rates, like what Director Wingraf kind of mentioned, along with information on housing stock, information from our public health department, community development, a number of others. And then they were to use that data to create their race and equity study. That all took place last fall from October to November. We met with them in December for what ended up being the last time for a very long time. We were told in January that their race and equity study had been completed, but it was under internal review. And then we didn't meet again. Each weekly meeting after that was being canceled until they completed the review of their race and equity study. Finally, after reporting that to both this board and to the Board of Supervisors, the Board of Supervisors sent a letter to the mayor encouraging Oakland to meet. August 12th, Oakland then met with us and presented their 70% proposal that you got to see in in September. Our meeting on August 19th was canceled. August 26th, we actually countered with the 60% proposal. On September 8th, Oakland presented to you a modified slide presentation summarizing their race and equity report, and they revealed that they wanted 70%, which was the first time ever that this stuff was really being spoken about in public. Up until then, I had tried to contain this and keep it confidential, but that door has now been open. September 16th, we met, asked for feedback on our counter proposal, as well as we requested the slides and the actual race and equity impact assessment report. September 24th, the team met again, and it seemed like the Oakland team was supportive of this 60-40 counter proposal and expressed their intent to write a process document for how the money was to be targeted for Oakland. And at that time, we did receive that yet to be published copy of the race and equity impact report that we can't share with you yet. It was at that time that we decided to direct our county council to draft an MOU because we thought that we were well on our way here. But in recent weeks, we are getting mixed messages, and thus far, we did meet on October 1st, but every weekly meeting has been canceled since then. We are scheduled to meet today at 12 o'clock. We don't know for sure. The pattern has been that we usually find out a couple of hours before the meeting that it's being canceled. Last week, we found out 5 minutes before the meeting was to begin. Usually the reasons that are given to us is that key team members are on leave or have emergency city council closed session meetings that are overriding our schedules. The actual counter proposal, I put up two visuals here for you to take a look at, since I know some people are visual learners here. But basically our counter proposal from the 42% that we originally proposed has gone up to a 60% proposal for Oakland. Oakland agrees that based on the particular skill sets that the Healthy Homes Department provides, that they would need to have us provide some of their services. So when you look at the pie chart, or if you can follow the bar chart better, you see that 60% is to go to Oakland. Oakland is to take 20% under our counter proposal and begin using it immediately as they see fit. The 40% of their 60% that they want the county to provide services to, we would be having discussions on that. As I mentioned before, the City of Oakland's team said they would produce a process document for us to discuss, describing how they would want us to deliver services in Oakland. 40% of the funds would go directly to the county to spend in ways that they see fit. When I did this pie chart, I put in here that we were in total agreement on this, and that, as I said, in the last several days has changed to where I'm not really sure. I don't know if the Oakland team has presented anything to the Oakland City Council. Our counter proposal, we did present to the Board of Supervisors in closed session. And so we did get their blessing, but I am not sure as of this time where the city actually stands on this. So as I said, on September 8th, you did get to hear the Oakland team present to you a summary of their race and equity report, where they explained why they felt that 60 to 70% or possibly more of the funds needed to be spent in Oakland. They also described to you the types of activities that they propose to use the money with. We do not totally agree, nor do we totally disagree with that report. As I said, we now have seen a copy of the race and equity report. We've been able to look through it, and there are some things where we do have some disagreements, or we do have some concerns, which I'll share with you now. In the report that you received on September 8th, they showed you the Cal Enviro Screen 4.0 predictability maps. These maps utilizes various data sets to predict where the most vulnerable communities are. Cal Enviro Screen has been used for a number of years by various organizations to make policy decisions. In fact, there is a state law that says all planning departments must use Cal Enviro Screen as part of their decision-making process. But it also says that you should not rely entirely on Cal Environment Screen because it's like any other data set or predictability map. It's not perfect. And in fact, when this 4.0 version was released in February, which I was kind of surprised because I thought the race and equity report was done in January, but Cal Enviro Screen 4.0 came out in February, and it went through a public comment process through the spring of 2021. And it did receive some criticism because Cal Enviro Screen 3.0 identified some communities as being vulnerable that were not described as vulnerable in the new version. And that can have a significant impact on different groups in terms of, for example, there were comments from some Asian groups in San Francisco that they would not be entitled to certain public funds to assist them with various programs because they were no longer identified as vulnerable in the 4.0 version, but they had been described as vulnerable neighborhoods in previous versions of Cal Enviro Screen. The other thing is Cal Enviro Screen 4.0 for the first time had a lead element to it. They had never had anything about lead poisoning prevention before. And so they introduced this for the first time, looking at data sets such as age of housing, neighborhoods with kids that are under 6, but it did not include any actual evidence-based data sets such as where children live that have actually been lead poisoned. So we have some questions about the Cal Enviro screen being the major basis behind the Oakland team proposal. But what I did to try to settle my own thoughts on this was I reached out to the California Department of Public Health and I asked them to take a look at the Enviro screen slide that you saw on September 8th. And it just so happens that the California Department of Public Health Child Lead Poisoning Prevention Branch also uses Enviro Screen to make some of their policy decisions. But they also include actual child lead poisoning case data in designing their policies. And when they looked at the Oakland presentation, I'm relieved to say that they did find some overlap. Areas that they saw, which is the predictability risk assessment map on the right of the screen. Those red areas, many of them overlap with the blue areas that you see in the Enviro screen lead risk assessment map that the city of Oakland used. However, the California Department of Public Health also said that there were areas of high risk outside of Oakland that they felt also were in need of some of the services that we are discussing in terms of use of settlement dollars. But there was significant overlap. And so that's why, as I said earlier, we are not in total disagreement with some of the information that the Oakland team is presenting. But again, we're not in total agreement either. So why did we choose not to get into a data duel with the city of Oakland? And you might recognize the face up there on the screen. That's from the Reuters report that came out a few years ago, where it was acknowledged by that reporter, Josh Snyder, that Fruitvale was ground zero for child lead poisoning. It was that report that highlighted the fact that the state Department of Public Health zip code map identified Oakland and much of Alameda County as having child lead poisoning rates higher than Flint, Michigan, but not due to the water, but due to aging housing. Over the last 2 years of discussions with the Oakland team, and we have not been able to spend any of the settlement dollars per the judge's order until we can reach an agreement. Meanwhile, children are being lead poisoned all over the county. So that's part of the reason why we could have nitpicked some of the data, especially when you look at this chart here that came from the California Department of Public Health that shows the number of children poisoned since the lawsuit ended and the county began talks with Oakland. You know, if you look at these numbers on actual children that were lead poisoned, you can see that these numbers don't really support a 70% or even a 60% allocation. But again, when we look at this over 30 years of experience, the reality is that historically the bulk of the casework over the last 30 years has been in Oakland. So I can argue myself against this data and say no, even though it doesn't justify even the 60% allocation, we have to look at this over a historical perspective. We have to take into account that during the pandemic, a lot of children are not being blood lead tested. And so if we didn't have the pandemic, these numbers might be different. And in fact, we're predicting that as we come out of the pandemic, that these numbers are going to change. So we needed to look at the big picture and giving thought to what Oakland's needs were, but also those outside of Oakland. People like Valerie here, who was also part of that article that Joshua Snyder did, who lives in Hayward, who is lead poisoned, and many other children who live outside of Oakland who are suffering with elevated blood lead levels. We had to take that into consideration. But one of the other things we had to take into consideration is the fact that there has been a historical movement of people of color, poor people, out of Oakland. The latest census shows that in terms of the Black population, there's been a significant decline. There has been a steady decline, in fact, in the African-American population in Oakland. They have been moving to other cities outside of Oakland into the unincorporated area. Unfortunately, some have even left the county altogether. So we again, in terms of partially disagreeing with some of the findings of the Oakland's negotiations team, this is one of the factors that we were considering. We were looking at data like this data from PolicyLink that shows the increasing number of people of color who are now renters in Hayward. We were looking at other sources of data and receiving comments from individuals who have watched the YouTube video or requested the slide presentation and are requesting the actual Oakland Race and Equity Impact Assessment Report. Comments like what you see here, where I quote, the person said, "The inequity that created this situation can't be aided by a new system that rewards census tracts being taken over by those who are part of the old system." Another similar comment, righting the wrong in Oakland should not come at the cost of continuing that wrong in those communities that people of color have moved into over the decades. 70% based on a predictive model indicator must consider the great migration factor. Otherwise, neighborhoods could receive services and see increased property values based on previous occupations by people of color, as has been seen when some jurisdictions receiving energy efficiency and earthquake retrofit funds saw them get snatched up by gentrifiers. So there are some concerns about race and equity, but there are also concerns, which I remember hearing last month from, I believe, Director Botters, that there is this concern about justice as well. Will this bring about justice? However, while recognizing the concerns of others that Oakland's proposal is too ambitious, we believe, based on our 30 years of partnerships, research, and multidisciplinary experience in nursing, environmental health, healthy homes, lead abatement, code enforcement, that Oakland has a chance to do something amazing with these funds in terms of what they're proposing in their Race and Equity Impact Assessment Report. So Dale mentioned the 1991 document that is really our origin document. It's basically our Bible, so to speak. Many of the things that were identified in 1991 as goals for what was then just a child-led poisoning prevention program, we hadn't become Healthy Homes yet. The things Oakland is proposing to do in specific targeted areas per what we've read in their Race and Equity Impact Assessment Report, they won't do it citywide. They're going to focus all arms to bear on some specific highly vulnerable communities. Things that, you know, we've been able to do to a limited degree countywide for the last 30 years. They're going to be able to bring all arms to bear and do all best practices in just some specific areas, almost like a proof of concept or a pilot project is what they're proposing in their Race and Equity Impact Assessment. So that's what we don't disagree with Oakland on these best practices. We just have concerns as these are limited dollars, and we have questions as to if their plan will have a broad long-term impact once the settlement funds have been used up. So you saw their proposal in terms of their elements. Many of the proposals that they're making, honestly, I have to say, are duplication. In many instances, they're duplicating the work of Healthy Homes, but they believe that they have a better idea for how to do it. Oakland plans to hire consultants to help them develop the services in the targeted areas. So duplication of effort, but if they can have significant success by focusing multiple strategies in a limited number of census tracts, it could have a possible ripple effect. So though we've advised them, of course, to abandon the plans for permanent abatement in those specific areas that they're identifying in their report, per the lessons learned from Rochester, New York. But if they can apply some of these strategies the way they're proposing, they could be right that by proving those strategies successful, strategies that have been done in other parts of the country to various degrees, but again, not in a concentrated way like they're proposing, perhaps it could result in more funding in the future. Maybe people would get on board with some of these best practices. So as I said, Oakland's plan is to focus elements in a select group of census tracts, while the county would continue to try to serve the county more broadly. Of course, as I said, some of the dollars that would be spent in Oakland would actually come to the county to spend in Oakland. And so this whole thing may be a great proof of concept. You may recall from September 8th, seeing the Oakland team present this slide to you where they describe their equity elements. As I said before, they're going to hire consultants to help them to further tune these equity elements in terms of an implementation plan. But again, this proof of concept does have its limitations. We do have some concerns. And so I do want to make the JPA aware in terms of expectations that we should keep them at their proper level. For example, there was a lot of talk last month about the proactive rental inspection program, which is one of the main pillars of their equity elements. We agree with Oakland. It's a great model, just like, you know, universal testing, which is something that has been discussed as well within their report. It's being done in a dozen states across the country. Proactive rental inspection would be a great model, great best practice, but good things take time. And proactive rental inspections take money. Oakland has formally discussed before their city council for over a decade the idea of a proactive rental inspection program. And in fact, the county itself has in recent years discussed it at a staff level with neither being able to implement one, although it's several other cities have done so. But again, Oakland makes this one of their key elements within their race and equity report. And so I have grave concerns. And here's part of the reason why. Before I got baptized in the waters of healthy housing and began to preach the gospel of child-lead poisoning prevention, I spent about 20 some odd years as a code enforcement officer, also working at on multi-agency task force at the state level, like the contractor state license board, unlicensed rapid apprehension team, the Bureau of Auto Repair, sting operations team, the SMART teams, as I call them, were often made up of police, sheriff, fire, hazmat, community prosecutors, you name it. The experiences I gained as a code enforcement officer led to me having some experiences establishing some rental inspection programs. But as I said, those programs took time, they took money, and in every instance, they were paid for either through a combination of general fund and fees on rental properties, which is part of the reason why it's so difficult to get a proactive rental inspection or even a reactive rental inspection program going. Because people don't want to pay the money. The first team that I managed in 1993, that program was brought together because the Legal Services of Northern California sued Sacramento County for not even having a complaint response program. And so we were ordered to pull that team together of environmental health specialists. That was my first team, and I was under the mentorship of the gentleman wearing the white hat, Art Seipel. Those folks were trained in lead inspections, but we still weren't proactive. Oakland is proposing a proactive rental inspection team that would actually be trained like the code enforcement officers in Rochester, New York, to become what they call lead sampling techs. So they would actually go and collect samples in units and turn them over to labs for analysis. And then based upon those reports, then they would take action to correct lead hazards. So we're talking about, quite a bit of money being spent on hiring people and training them to be lead techs. My other team was made up of zoning and vehicle abatement officers that I had to bring in building inspectors to provide them with training. Again, this was not something that could be done quickly. And then my third team that evolved into Sacramento County's proactive rental inspection program, actually, it took 9 years to pull that together, to get everyone on board, to get the landlords willing to pay the extra money for the program. So in terms of Oakland's proposal, my Healthy Homes heart says yes, but my code enforcement officer conscience says that no, you should not be using these settlement funds because they're not sustainable. The settlement money will run out. And what will you do then? Do you have a guarantee from the Oakland City Council that they're going to be able to fund a proactive rental inspection program? But again, the longer we take to try to work these things out, to make good use of the funds, the harder it's going to be for future lawsuits. We know that attorneys are watching across the nation. This panel discussion I'm going to be on, that's one of the things I'm supposed to be speaking about, is how we're proposing to use the lead settlement dollars, because people want to know, they want to follow suit behind us and sue the paint companies. And we know the paint companies are watching and waiting and hoping that we fall flat on our face in terms of how we use these settlement dollars, so that they can then use that in courts in other states. Last month, the JPA, upon seeing the Oakland lead settlement proposal, said that you support race and equity lenses being applied in the use of the funds. You encouraged communication, and you also encouraged us to have less talk and more action. So this really does now come down to who can hit the ground running. And we have 3 years of annual settlement dollars already collected from the paint companies. And that's sitting in the county coffers and just waiting for us to use it. So you probably want to know a little bit more about how we plan to spend the money. And Dale has just a few slides that he wants to show you that kind of describes that.
So thank you. I just want to provide an outline of our proposed strategies for the settlements funds to be spent outside of Oakland. And basically, we're looking to reduce the impact on kids that are lead exposed now and make lead safe property maintenance and management the standard of practice in Alameda County. So we're going to care for lead poisoned children. We're going to increase the demand for lead safe services and build an infrastructure to support that. Larry, if you would, the slide. In terms of the response to lead poisoned children, we want to expand and enhance our services down to the 4.5 micrograms per deciliter, which is how the state interprets the CDC's level of 5. Reduce harm for them and prevent higher levels of exposure. Use those opportunities to educate the public and property owners, and then these things all tie together, provide referrals for lead hazard repairs and testing, and when necessary for our compliance partners to make a difference, and then train the agencies and advocacy groups, home visitors in terms of what they should be looking at so that we can make sure to keep children safe. Next slide. So we need to increase the demand for lead safe services. Really, I'm going to say this a couple of times probably, but some of this work needs to be countywide. Contractors, consultants, property owners aren't necessarily in just specific areas. It needs to be everybody's concern. So we need, and we're, we see some of this, tenants questioning their landlords, is my property lead safe? We're at my home. Neighbors calling out unsafe renovations. We need more of that kind of education. And then we want to continue to encourage testing, and for priority housing, use the HUD lead hazard control laws and dollars and expand and enhance those for, our priority housing. So next slide, please. And build and support an infrastructure to do that. So we want to train existing contractors, maintenance workers, property managers, property owners, support code enforcement, rental inspection. So they have the tools and the information, education that they need, training in order to do that. Work through our private sector, partners, the rental owner associations, as well as the community-based organizations. We also want to develop the emerging workforce. We want to do more like what we're doing with Cypress Mandela Training Center, where lead safety becomes part of their construction training program. For other workforce development, where maybe people haven't selected construction as their path, they're still trying to figure it out, do career awareness, and then connection to training opportunities for those who look at this construction path as where they want to go. We also want to support small businesses and nonprofit enterprises. When we're looking at our lead training opportunities, we want to make sure that we're reaching everybody. So we'll provide, maybe a certain amount of training to any company. Big companies, you want to train everyone. Okay, we'll train a couple of people, but you need to train the rest. Step up. Smaller companies, let's see if we can train your workforce or your key workforce. And then look at developing support for small businesses in terms of not only the lead training, but also their procedures, their compliance structures, and their marketing materials, so that they can compete and do the work lead safely. To the extent possible, keep contracting opportunities small and ongoing, so that as folks are identified, get trained up, they can start doing work. And apply that same process to the community-based organizations. We really need to get the private sector involved. When you look at the settlement funds, it's less than $60 per pre-1978 home. So that's not going to address lead hazards everywhere. Thinking back, Director Wingraf, to your earlier question, I think we're finding that many properties are better maintained. Tenants are increasingly asking their landlords to address lead concerns. Energy programs have been replacing old, windows with lead on them. And when we do an environmental investigation, we go to the owner and say, you need to address these lead hazards. We're getting less resistance from them. There's more of an understanding like, yeah, I need to take care of this. Now, what we really need to do is get them to be proactive about it and not wait until we show up with an environmental investigation in hand. And I think countywide, to make this everyone's concern. However, as Larry noted from our discussions with Oakland, there are at-risk neighborhoods and communities. And some of these are geographic areas. And then there are also at-risk communities that share cultural identity, language, race, or ethnicity characteristics who may not be in a geographic spot. We need to do more to reach out, find, and identify those. And that's, again, one of the things that I'm very hopeful with these settlement funds, is that we can have the resources to put into this evaluation and data gathering. So we can answer these questions. Yeah, how does Alameda County compare to Los Angeles once you take adjustments for demographics and income, et cetera? Can we look at these at-risk communities, both those that aren't in a geographic place, but also those neighborhoods that are most at risk? What is happening there? What can we do? What impact are we having? This conversation about the best use of these funds is part of a larger conversation locally and nationally about justice and equity. And we really need to use this as an opportunity to bring those principles in and answer those questions. I expect to learn a lot from working our partnership with the City of Oakland. We've been a longtime partner with them. I was just, thinking back, one of the first joint projects I did with Lloyd Ware with the housing rehabilitation program way back in the day. But we also want this plan to be flexible enough to adapt to changes, demographic changes, and make sure that we're doing the best that we can and reaching the folks that we need to. So We want to take care of the lead poisoned and lead exposed children now, make lead safety the standard of practice countywide, leverage the private sector and the power of our communities to demand that lead safety, and then support and build an infrastructure of trained workers, home visitors, contractors, consultants in order to get this work done. Larry, back to you.
Thank you, Dale. So in conclusion, we have our counter offer that we hope has been seen by the Oakland City Council, as it has been seen by our Board of Supervisors, and now this JPA board has seen it. You know, one of my mentors, Professor Shaheen in Michigan, always reminds me that the best legislation is often the legislation that nobody likes, but everyone can live with. The counter proposal was not liked necessarily by all the board members, but they bought into the logic that I've just explained to you, that Dale has just explained to you. We're sure that the Oakland team wanting 70% will not necessarily be totally happy with it. But again, the best legislation is what can be lived with. And I think that this counter proposal is very generous. We have children that are being lead poisoned, have been lead poisoned over the 2+ years that we've been negotiating. We have not heard from the Oakland team yet as far as if the 12 o'clock meeting is going to take place, which I hope it does. I hope it is a meeting in which they say that they bought into the counter proposal and they're ready to go forward with the MOU. You know, we have their race and equity impact assessment report that proposes the lead poisoning prevention in certain targeted areas, which I know I can't share what those areas are. That would probably be something that they might want to come back to the JPA and share, or at least share with their city council. Their proposal, you know, emphasizes using settlement dollars for proactive rental inspection programs and consultants, which I know it takes time to bring on consultants, although I've had the opportunity to at least make them aware of some people who I think would be great consultants. I'm not one of those people, although the reality is I've been providing advice to Oakland since 2013 on proactive rental inspection programs, and have spoken to the city council and the Community Economic Development Committee on several occasions about it. We have community members questioning the distribution or the justice portion of this based on issues such as gentrification and displacement, the migration of people of color out of Oakland. But as I said before, I believe that the Oakland proposal has many strong points. Their race and equity assessment report makes a lot of points that I do agree with. I just don't necessarily agree with them all. So that concludes the lead settlement update, and I appreciate your patience with our report.
Okay, before we go to questions and comments, is there any public members who wish to speak on this item?
No.
Okay, I see no hands either. So we'll move to directors and begin with Director Wengraf.
Yeah, thank you, Dale and Larry, for this report. There's tremendous amount of information in here. And I'm very appreciative of it. I have to ask this question. It's a little awkward, but as the representative from Berkeley, how does Berkeley fit into the settlement?
Berkeley falls into the category of funds to be used outside of Oakland.
Okay. Okay, and have you been in touch with our Health and Housing Department about that?
We have not spoken to them. As I mentioned, we had actually been trying to keep all of this under wraps until we could hopefully announce that we had reached an agreement with Oakland, but things have now somewhat changed. The cat's out of the bag. The Pandora's box has been opened, I guess. So we will be speaking to Berkeley soon, because we do have strategies here that we want to apply to all the cities outside of Oakland, as well as the unincorporated county. But we really can't move on this until such time as we can reach the agreement with the city of Oakland.
Our Director of Health and Housing is Lisa Varhus, who you actually may know. She used to work for the county. And I think she would welcome a conversation in the future, whenever you're ready.
Okay, thank you.
This report has made me think of several things, and I don't want to get too far afield. But when I've been doing a lot of work on hazard mitigation and risk in terms of wildfire. And some communities are beginning to require that at point of sale, you certify that you have cleared your property as required, by your local fire jurisdiction. And I'm wondering if you have ever thought of using that same tool for lead abatement.
Yes, that has been a model that's been used in some other jurisdictions in terms of making the property owner responsible for providing proof that their lead hazards has been addressed. Baltimore is one of the model programs that comes to mind. It is a way of oftentimes reducing the cost of the rental inspection program because you're now no longer asking the city to pay for inspectors, but you're pretty much asking the landlord to hire someone who is a certified lead inspector risk assessor. So it also has that opportunity to, in terms of workforce development, to create jobs, which was what Baltimore reported to me, that over a period of like a decade, they saw a booming workforce in lead inspection risk assessment as a result of their ordinance that required landlords to provide proof.
Yeah, is it possible that some of this money could be used to create such a program in the county?
Well, based on what Oakland is proposing, yes, the money could be used to be seed money to start a program like that. Again, my concern is just the sustainability. If we know for sure that we're going to have funding sources to continue it, that makes me feel more assured that when the paint company attorneys are trying to argue against other states, they won't be able to point to Alameda County and say, look, they started this, but then they didn't finish it. They no longer have a program like that. So they basically just, threw our money away.
And when a tenant moves into a unit, is it the responsibility of the landlord to disclose that lead paint is present?
In fact, there are disclosure requirements not only for the landlords, but also for buyers and sellers of homes as well. There's real estate law that requires those disclosures. Dale, you want to add to that? You're muted.
Sorry, I just wanted to note that there's not a testing requirement under those disclosures. It's part of the federal 1018 disclosure requirements when you sell or lease. If you know of lead-based paint or lead hazards, you're to disclose it, and you're to provide a standard educational brochure, which we make available, regardless of whether you know that there's lead hazards or not. But there's not a requirement to do testing.
Okay, so the disclosure is based on.
So the disclosure, if no testing has ever been done, the disclosure would be, this is a pre-1978 residential unit, and it may have lead hazards.
It's
And
very
here's
vague.
information.
It's very vague. It's not specific to that property. I think it's a standard clause in the lease, and everybody sort of just says, okay, whatever.
Right.
So what I guess I'm suggesting something a little bit more specific, because once that tenant moves in and finds that there is lead present, then it becomes a very complicated process to mitigate that condition. So anyway,
Right.
I'm just, this is all getting my brain activated, just throwing out.
Yeah, and if testing has been done, that is part of the disclosure. If you have testing, you need to
So we
disclose it.
can't require testing.
That rule does not require testing.
Okay, thank you.
Thank you, Director Gaio.
Yes, thank you for the information. So, and hearing the county's response for the first time, and it was stated that there's a meeting actually going on at 12 noon today to continue negotiations. Who at the city of Oakland level is the lead negotiator? Because this item hasn't been brought up before the council. In
That
terms
would
of
be
where we are.
that would be your assistant city administrator, Latanda Simmons.
Oh, she's okay. So she's taking the lead on this subject area. Okay.
She's the negotiations team leader. Now, again, in their defense, originally it was Assistant City Administrator Jason Mitchell who left
Yeah, he left. Yeah.
go to City of Baltimore. Also, the chief building official, I can't think of his name now, left to go to the City and County of San Francisco.
Okay.
So with that kind of turnover, it did affect our having some meetings canceled for sure. The meeting today at 12, I don't know. Typically what happens is the day before the meeting or a couple of days before the meeting, I will send out a text or an email to Oakland's negotiations team asking them, are we going to meet?
Yeah.
And typically I don't find out if the meeting is going to be canceled until a few hours before the meeting. Or like I said, last week, 5 minutes before the meeting. I have not heard anything from the Oakland team
Okay.
in response to my communication yesterday, asking them, are we meeting today?
Okay. So at this point, you have not even seen what we're proposing with this negotiating meeting.
So with this meeting, what we were anticipating, the last two meetings that were canceled, we were told that the Oakland team had some questions concerning the memorandum of understanding that our deputy county counsel was drafting. And so we said, fine, when we meet, we can try to answer your questions. I really thought that it was pretty straightforward that the county would like their 40% to begin doing work in all the cities and unincorporated county outside of Oakland right away, and that we were more than happy to continue to meet and negotiate with the city with regards to the 60% that we're proposing be spent in Oakland. So I'm just not sure what their questions are. I thought maybe their questions were coming by way of city council, because in our more recent meetings, they seem to be supportive and in favor of the county's counter proposal.
Okay, so then, but you are part of the negotiating team for the county, because the only thing that I received that was really the discussions were between the legal departments with the county and the legal department with the city.
Yes, when we sent our draft MOU over to Latanda, we did also copy the new person from the city attorney's office who is on the negotiations team. And I did say that I really felt we had reached a point now where it really was a matter of the legalese of the MOU, because at that time I thought we had reached agreement on the 60-40 split. So it was just a matter of working out the legalese and then taking the MOU before the city council and before the board of supervisors. But again, in more recent meetings, other than the canceled meetings, I've received some communications that there may be something going on in terms of concerns about the MOU language. So I know our county council has been talking to the deputy city attorney or supervising attorneys. They met Monday,
Okay.
and they're going to meet again next Monday to discuss the MOU. But I'm getting word from Latanda that there are some questions that the team itself has about the MOU.
All right, well, let me, the minute we terminate this meeting, I'll check in with Latanda and the city administrator to see where we are, because we got to get this done. Otherwise, it's between the city and the county. We threw we go through a lot of bureaucratic discussions, debates, and meanwhile, the people on the street or the people living here are paying the price for our bureaucracy, not getting it together. And but thank you for this information, and certainly we'll get a response back to you. We want to get this done and move forward to address the needs that have been here for many, many, many years. And the ultimate people that pay the price are the children of Oakland. And while we're negotiating back and forth. And so anyway, so thank you for that information. We do need to deliver the service, and I appreciate the recommendations that you provided, and we'll get back to you real soon.
Thank you.
Thank you, Larry.
Director.
Thanks. Thank you.
Thank you, sir.
Okay, I don't have very many comments. Mine are aligned with what everyone else has said. I have no questions. I just want to put on the record, as I've said from the beginning, in I think is agreement with what Director Gaio just said. We have continued to sit on money we fought for a very long time for. And in the meantime, every day there are more children exposed to this problem. And I will be very honest, I don't want to make it sound inappropriate or rude. I don't care where they live. There is not enough money to solve the problem of all the children who are at risk right now. So while I do agree that we need to make our best effort to target it to the most disinvested and impacted areas, I want that to move in a reasonable time frame, and like even if that means the agreement needs to have some flexibility to say we just agree it will be concentrated in these areas. We just need to implement and give agencies that are going to do the work the time to do this, because it just becomes more and more expensive to do this. The dollar is losing the value of how many people it could serve, and we're not getting the social and health benefits of helping kids. So for me, equity is always at the front, but at some point it becomes challenging if bureaucracies become impediments in trying to implement that. So I do hope, I will be looking forward to an update. I do hope that we move this along in a timely manner, because we need to just move this into the neighborhoods of children who are and families who are being impacted by this. So that's my comment. I'm mindful of the time and the fact that there are other meetings directors have to get to. That was a very long presentation, but a needed one that we've wanted. So thank you. We'll close item 6. Item 7, the August and September monthly reports. If that could be done very expeditiously, I would appreciate that.
Okay, let me see here. Ladise, were you still having some audio problems? You are. Did I hear you? Maybe, no, okay, she's having audio problems. So
I can unmute.
We can hear you.
we can hear you.
Oh, okay. Well, okay. The buttons on the screen are not working. Okay, very quickly, as Larry mentioned, we're celebrating the 30th anniversary, and as a result of that, we've done a lot of radio, we've done a lot of web announcements in regards to this, huge celebration. And also, we distributed 100, what was it? Newborn kits to first 5 Alameda County. Larry, are you able to share that screen?
Just this one that shows the different the bibs and the booklets.
Yeah, so basically at the screen at the bottom, it's basically those are the kits that we're distributing, and it has a lot of that information, of course, is going to the community that we're trying to serve. And that concludes the monthly report.
Okay, are there any questions about the monthly report? Is there any public comment on the monthly report?
No public comment.
Okay, seeing none, that we'll accept the public or the monthly reports. That's item 7. Item 8, future agenda items. Are any members here have a future agenda item they wish to have put on a calendar for a future meeting? Seeing none, we've received no public comment on future agenda items.
No.
Okay, we will conclude future agenda items. There's nothing to add at this time. Number 9 is announcements by Board of Directors members. Does anybody here have an announcement they wish to make? Okay, seeing none, we'll move to agenda item number 10, which is adjournment. The time is 10:51. This meeting is adjourned. Thank you all for being here today. We will see you. Reminder that the date in November is a week earlier than usual because of the Thanksgiving holiday. So I believe that is the 18th of November. Is that correct?
Yes, it is.
Okay, the 18th of November, virtually at 9 o'clock in the morning, we will convene back here. And then the December meeting will also be, I believe, a week or 2 weeks early. It's a week early as well. Is that right?
Yes, it is.
Okay, and the December meeting, we will not do business at the December meeting for Director Gaia's benefit. We actually And Director Wengraf, is Berkeley still going to take care of the festivities remotely this year, like Director Bella did last year for the December meeting? You had volunteered, so you're on mute. You're on mute, Susan.
Sure, I didn't know anything about it, but I have time to get it.
Yeah,
all.
you volunteered last year at the end of the
Well,
year.
I mean, it's COVID. Do I remember? No.
Okay, all right. That's why I checked now, so I didn't put you on the spot in November.
Oh,
So
thanks for the heads up.
okay, so we'll trust you to figure out that we have a little more of a social hour at our December meeting. We invite all the staff to join us. So
It's
okay.
gonna be via Zoom. It'll be
via Zoom. Yeah. So if you remember, Director Vela sent each of us a little bag with
Yes.
goodies and things in it. We had some time together. So we decided that as long as we're in this space, we would rotate, and Berkeley offered to go next. So I just wanted
That's
to check.
great. Thank you for the reminder.
Okay. All right. So I will officially adjourn us at 10:52. How about that? So 10:52, we're adjourned. Everyone have a great day.
Thank you. You too.
All right. Bye.
Thank you. DC, I guess you can stop the recording
Oh, God. Yeah.
if you got your buttons back.
You know, your screen disappeared for a minute, actually.
Oh, boy.
Let's see. More.
It says it's still recording.